As someone actually who had come to a mental health trust with no experience in a mental health organisation, actually you come with a very different sort of set of goggles on in that sense. And for me, one of the things that I felt we had to address was this thing about normalisation. We have issues of the physical and chemical restraint of patients. We have issues of people dying in our care by suicide. So we had a long discussion at our board, but it was both, it was a clinically led discussion. What we said was, what's our ambition around safety and outcome for patients? And that was really the point in time when we said, well, shouldn't we develop the concept of perfect care? By putting the construct of perfect care up, we ask our organisation to say, so what would it look like? And there was a very interesting confluence. Quite a lot of our staff came forward and said, zero restraint, zero suicide, really, really good physical health care, not just really good mental health care. And the confluence was, that's what our patients were saying as well. And the thing we did decide on was, when we said zero around some of these things, the big, hairy, audacious goals, the board itself was very clear that these weren't concepts. They had to turn into sets of practices. And to understand that OD was really, really critical to that.
I'm very fortunate because I've got a chief exec who understands the impact OD can have. He recognised the complexity of our organisation as a system, and he knew that required an OD approach to actually supporting and enabling what we wanted to do in the redesign of Mersey Care. You mightn't have classified it as OD language, but Joe was using OD language.
For us, it is very important to recognise that the organisation is a human system, to shift mindset around workforce strategy. We had a huge period of engagement. So to talk about dialogic OD, we absolutely facilitate conversations to develop understanding, to inform that intelligent action that's actually going to make a difference.
For us as a board, we had to decide on a course of action, and ours was to open ourselves up, to be transparent in a way that says, actually this organisation, in the decisions it takes, however it takes them, often creates an environment in which it's impossible for somebody to do the right thing, to do the best thing possible. And that for us has possibly been the most transformational thing actually that we've done. Our hypothesis eventually evolved to say, if we're going to ask staff to go the next bit on these very challenging journeys, that this thing about psychological safety has actually to be the thing that organisational development has to be based on.
One of the achievements I'm most proud of for OD at Mersey Care is how we've developed psychological safety. So for there to be psychological safety, we have to have open, honest dialogue and healthy relationships, trusting relationships. I think one of the proudest things that we've done is to facilitate trust, and trust and psychological safety go hand in hand.
I left an organisation that I was very attached to and had a great experience of. And I moved into an organisation that was very clearly trying to, I don't want to say reinvent itself, but certainly create a culture of kindness, compassion, of trust, and of looking after the staff that work within it. It was easy for me to walk in and think, wow, this is a great organisation, and this is an organisation that really wants to look after and care for its staff so that the staff can look after and care for the patients. I believe that there are quite a few people that have been in the organisation for a long time, and those people may have not always experienced the culture that the trust is striving towards. So For me, as a leader within the Trust, it was really important to role model what it was that the Trust was trying to achieve, to role model looking after the staff, showing compassionate leadership, allowing the people that are delivering very complex work to feel that they're trusted and respected as practitioners, so that they can do the job, the very difficult job that they need to do.
When we look at a number of our data fields, there's no shock to say that when you're looking after your staff to deliver patient experience and output care at its optimal level, if they feel safe, psychologically safe, and able to raise concerns or worries in the workplace, the care that they give is better.
What we have seen, both around the direct relation to workforce dynamic, around reduction in disciplinaries and suspensions and all of those sorts of things, which do, of course, give you an indication of the extent to which staff believe you've got a fair and just culture. But that also saves a shed load of money, by the way. But then when you look at, over the 4 years, we've been looking at the reduction of restraint in our services. We've probably reduced the number of physical restraints in our services about 70% in the last 4 years. That equates to millions and millions of pounds of savings. So in the background, we're delivering our cost improvement programs. We're delivering our cost improvement programs by making our services safer and more effective from the get-go, rather than delivering our cost improvement programs by cutting the enablers that make those things safer and effective in the first instance.
The real light bulb moment was having an OD approach to everything, designing structures, designing systems and processes, designing interventions. That behavioural relationship component, whatever you do, anything, at all, OD is everything.
We're a conduit. We facilitate relationships, facilitate sense-making and understanding of what the organisation is doing, why it's doing that, to align people's thinking and action to that, to support them in a very different way in terms of resilience, capability, to be able to deliver what the organisation is describing.
You will have board papers that talk about changing the culture. You will have board papers that have a strategy somewhere in which it says we will change the culture of the organisation. And what I'd say is ask yourself the honest question, how am I going to do that if I don't invest in OD?